Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Inside segment. I'm Harold Fisher. We're talking about the flu right now. Health experts are sounding the alarm as cases are spiking across the country, including right here in the DMV. Activity is in the high to very high range. And nationwide, the numbers show a moderately severe 2025 to 2026 season with millions of illnesses, tens of thousands of hospitalizations, and of course, unfortunately, rising pediatric deaths. And there are also changes in those vaccine recommendations coming from the CDC for children. Tonight, this is a Wellness Wednesday conversation, and we're going to break down what this all means for families and how you can stay healthy this winter. My guest is Howard University Hospital pediatrician, Dr. Habib Shariat. Dr. Shariat, thank you so much for spending some time with us. I appreciate it.
Glad to be here. I did not hear the question.
Not yet. Well, the questions are coming. I just wanted to make sure that people understood your level of expertise. And I want to share some of these fast facts with our listeners. According to the CDC, there have been at least 11 million flu cases this season, 120,000 hospitalizations, and 5,000 deaths for the week ending December 27th. And heartbreakingly, there have been at least 9 children who have died as a result of this flu season. When you hear those numbers, what comes to your mind, as a pediatrician who is having to address these issues?
Well, these are the numbers that had not been seen over the past 25 years. So that points to the fact that there is something going on. And among the factors that are contributing to this increased severity and activity of the flu is the emergence of a strain of a flu vaccine called subclade K, which is notorious to spread very rapidly and somehow evade the complete detection by the immune system provided by immune response that has been provided by vaccination, and also the fact that vaccination rate in this country for the past couple of years, for many reasons, had been in the lowest, like around 42% of adults in this United States had received this year vaccination. Even with the contrast this year, this is among the lowest vaccination coverage in our communities.
And I do want to talk about that a little bit later.
Was one reason.
And I think over the past several weeks, as we began to start paying attention to this, initially the CDC said that in the tri-state area of New York, that was the highest in the country, and that the DMV, DC, Maryland, Virginia was high, but not very high. But just over the past several days, we've seen Maryland, for example, begin to see a very high level of flu cases. And personally speaking, my sister sent me a text last night telling me that she has the flu. She lives in Maryland. One of my best buddies, he lives in Montgomery County. He has the flu. One of my other good friends who lives in Baltimore, she has the flu. So these are not just other people. These are people that are affecting all of us. And I'm not a physician, but it's really frightening to see all of these people becoming infected.
Well, as I said, This is the new serotype of the virus. Vaccination, lower vaccination rate, holiday travels over the past, and gathering over the past 2 to 3 weeks have been really largely contributed to this increased activity over the span of the past 2 weeks, up all the way up to second week in the December. CDC was calling the sort of a moderate flu activity. All of a sudden, over the past 1 week, that was increased to a moderately severe with a low confidence. That low confidence means that going forward, this moderate severity could really become severe. So that is what we are seeing. All these things points to the fact that the community seems to be unprotected fighting this new strain of the flu virus.
Explain this to me and clear this up for me, because I have, in really paying attention to this for many, many years, I was always under the impression that your flu shot prevents you from catching the flu. Let us say there are 7 strains, and a particular flu shot for a particular year will protect you against 5. So does that mean that the 5 strains that you may be exposed to, does it prevent you from catching the flu, or does it prevent you from feeling severely ill if you come in contact with those 5 strains? Because I think people need to know that.
Both of those statements are true. So the way that the vaccines are being produced annually is the expert epidemiologists would sit down and, based on their calculation and surveillance of the flu activity of all over the globe, come up with 3 or 4 strains of flu vaccine that seems to be more prevalent and more active during this coming season. So they usually decide on those. This year, the vaccine contains 3 strains of various viruses, 2 of the A type and 1 of the B type. So if everything that they assumed in preparation of this vaccine was correct, their prediction was correct, and any of these vaccine that is in the any of these viruses that is in the vaccine was the prevalent vaccine virus during the season, this vaccine would have been able to really protect all the recipient of the vaccine from the virus infection, both not getting sick, or if sometimes for whatever reason they get sick, if they get infected with the manifestation, the symptoms of the infection would be much, much subdued and low. So both statements are this year. What happened that these 3 serotypes were selected, and the order was sent to the manufacturing companies about what to produce. But this new serotype arrived here in late summer. The vaccine was already in production and was already distributed. Although the vaccine does not have the same exact K serotype, because there is a H3N2 serotype, which is the same serotype clade K, that the vaccine would, if it may not protect the individual from getting the infection, but it certainly protect them from getting the sickest form or getting very sick with the influenza infection.
What do you say to people, and I've heard this so many times, when they say, every time I get a flu shot, I catch the flu? They say that the flu shot gives them the flu.
That is one of the biggest myths around. This vaccine is inactive vaccine. All the serotype of the flu virus that is contained in the vial of the vaccine is inactive. They're unable of replication, which is becoming bigger and more becoming pathogen, and they do not cause any infection. What they do have is the ingredient of the present in the flu virus. Those H3N2 stands for antigens in the flu virus. So your immune system would pick up this particle as a foreign particle and develops antibody against the flu virus. So there is no way that anybody could become sick with the flu strain that is in the vaccine. Remember, if there are other serotype, other strains of flu vaccine that is not in the vaccine vial, the recipient may get exposed to those strain and become sick with a mild flu. Usually that happens very rarely.
Mm-hmm. But so are you suggesting that even if they hadn't gotten a flu shot, they probably would have caught the flu anyway?
Absolutely.
Mm-hmm. One of the other things, and this goes, I think, back to the heart of these unfortunate pediatric deaths, and I've had this conversation with physicians and other flu experts for years. A lot of people often associate the flu with a very bad cold. That is not the case.
That is not the case. Flu has a different, so there is no what we call clinical case definition. Some infections have a specific description of their symptoms that if you tell somebody that I have this, they'll say, oh, 90% you have this one. That clinical symptomatology correlates with that illness. In case of flu has almost the same symptoms as common cold, sometimes as COVID, sometimes as RSV. But the thing is, the symptoms by itself are not enough to make a diagnosis. Although among these 4 respiratory illnesses that I counted for you, flu has the most serious and significant symptoms. The fever, which goes 103, 104, 105, relentless for a few days, and takes your energy away. You feel malaise, you feel weak, muscle ache, sore throat, runny nose, nasal congestion, and in younger kid, gastrointestinal symptoms like diarrhea, vomiting, and in the elderly, respiratory symptoms with shortness of breath, all those things. But these can only guide you that you have to be tested. You have to go to see your physician to be tested. That is the only way to diagnose the flu. If somebody comes and says, oh, I got the flu vaccine and I have this. Well, as long as you have not had a confirmed flu test, you cannot say that this was a flu. And most often, flu by high symptomatology would make you to go to see your doctor and test will be done. And in case of positive one, there are treatments available that can protect you from getting sicker.
Mm-hmm. Mm-hmm. Is it too late to get a flu shot?
Could you please repeat the question?
Sure thing. I was asking, is it too late to get a flu shot?
Not at all. No, not at all. Although the best time would be all time. We start usually administering flu vaccine around September.
Around September,
early in the season would be protected. But even right now, because the worst has, I do not want to predict something, but flu peaks usually late December, January to February. And this can be protracted all the way to March and April and sometimes May. So getting the flu vaccine, even right now, is the best way to protect yourself. It takes only 2 weeks for the vaccine, after the administration of the vaccine, to become active and protect the recipient. So it is not too late at all. By all means, people who are listening should go and get vaccinated.
Okay. Dr. Shariat, hold on for just a moment. We are going to take a break, but don't forget, you can hear this in every edition of the Daily Drum Insight segment via podcast on WHUR.com. The original Quiet Storm with Raheem Devon is coming up next on WHUR-FM. This conversation continues on Sirius XM channel 141 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We continue our Wellness Wednesday conversation about the flu season. My guest is Dr. Habib Shariat, a Howard University hospital pediatrician. Before the break, we were talking about, is it too late to get a flu shot? One of the things, and I'm not a doctor, but I want to share the thing that has kind of worked for me, and certainly you need to consult with your physician as well as your children's pediatrician. But one of the things that has kind of worked for me is, instead of going and getting my flu shot in September, and I come from a flu shot family. I mean, that's what we did for decades. That's what we did. I always waited until October instead of September to kind of give myself coverage well into December. And that is the kind of thing that has worked for me. But one of the other things, and I want to talk about children in a bit, but staying with adults, and again, this is kind of my personal story, and I'd like to know your thoughts. I've had pneumonia 3 times in my life. Once when I was in 4th grade, once when once in 2001, January of 2001, and once in the I guess the mid 2000s, as it were. And I will say that in each of those particular instances, I did not get a flu shot. And for me, that my flu always progressed into what I guess they call walking pneumonia, and the like. What are your thoughts? And when I share that with you, what are your thoughts about that?
Well, remember, pneumonia is a respiratory infection. It's a lung infection.
Mm-hmm.
The major cause of lung infections is not flu. The major ones are bacterial infection called pneumococcal infection, which we have a vaccine for it available for elderly, for young kids. We do give it to them. And there are other bacterial germs that would cause pneumonia. So most of the cases, as if you look at the side effect, the consequences of flu infection is pneumonia in elderly whose immune system is low and they haven't received their vaccine. So flu can and will cause pneumonia, but not to the degree, especially not in young, healthy adults like yourself, that you explain your experiences to me. Most often those are due to bacterial infection.
Interesting. So I want to talk about children. As we said in the beginning of the program, so far there have been 9 pediatric deaths related to flu during this flu season. What is the thing that causes a pediatric death related to flu? Specifically, what is the thing that is killing these children?
So young children have weak immune system. That weak immune system is innate. This is when they are born. It takes time for the first 4 years of their life, they are very weak as far as that's why it is the time that we are using to vaccinate these children with the weaker or inactive germs to build their immune capacity and to build their immune defenses. So one of the highest risk population in any community is kids younger than 5 years of age, just because of the immaturity of their immune system. And the current recommendation has been changed this year, but it used to be all the way every healthy children over the age of 6 months was recommended to receive annual flu vaccine, just because of the fact that these kids have to be protected. And these 9 children are testifying the fact that if we do not immunize our infants and children, we are going to see much more of these tragic events coming our way.
So that's why historically we've always heard that the most vulnerable people as it relates to the flu are very young children and seniors.
True.
Yeah. So I did want to ask you.
They are not the only actually groups. They are not the only to know about it. Pregnant women have, because of the pregnancy, they are in a weakened immune status as well. So they are encouraged during their pregnancy, during the season, to receive flu vaccine, not only to protect themselves, but also to pass on some of those antibodies that they generate to the growing fetus, and at the time of birth, they will have some protection, because as I said, the vaccination is indicated for infants and children older than 6 months of age. During the first 6 months of life, they are unprotected and they rely on whatever they have received from their mother. So pregnant women are a priority and high-risk group. Also, you mentioned elderly, also the people with chronic illnesses is those who are getting chemotherapy.
I'm sorry. You broke up. You broke up just a little bit. You were talking about chronic illnesses. Repeat that again, if you can, doctor, please. I'm sorry.
I did not hear last.
Yeah, I lost you for just a moment. You were talking about chronic illnesses, and I didn't hear what you said after that. Please repeat what you were saying.
So all those people with chronic illnesses, underlying conditions like diabetes, those people who are receiving chemotherapy agent, those people who have received transplant, and they are suffering from chronic illnesses, they have weakened immune system, and they should be prioritized to receive their vaccine. And in some cases, a specific type of vaccine, which we call high-dose vaccine or potent vaccine, are geared toward those elderly older than 65 individuals.
We saw during the pandemic, as it relates to COVID, there was the huge campaign and push by physicians about masking, hand washing, staying home if you're sick. Does this apply to the flu?
Absolutely. More so hand washing, the standard really preventive measures. Proper hand washing, either with soap and water for 20 seconds or alcohol-based sanitizer would be very effective. Frequent hand washing after coming out of the crowded area, after coming from outside, traveling, go to the shopping center, not only sanitizing our hands, but also hard surfaces, spraying with alcohol-based sanitizer too, because the flu virus can stay in solid surfaces for a long time. Doorknobs, doors. In children who go to school, their gadget, the school gadget, their backpack, their handheld electronic device that they are holding, those are subject to be sanitized, to be to reduce the spread of the infection.
Hmm. Here's another question that I'm sure a lot of people are wondering. We always hear about flu season, September through late winter, early spring. Why why is that flu season? Why isn't flu season spring through fall? What determines what flu season is?
So the flu activity, the reason you see the CDC post measures and post the flu activity on a weekly basis, when you look at those annually, you see that after the March, April, the flu activity really becomes very subdued. So it is not really uh, uh, sort of a as far as the benefit versus risk, benefit versus cost. So there is no reason for to have an annual. Again, remember the globe has two hemispheres,
Hmm.
and though that hemisphere, the southern hemisphere, do get their flu vaccine when we are in our non-flu season. When we are in the spring and summer, they are in fall and winter.
Oh
So there's
yeah.
always annually there are two version, sometimes the same version uh, in both hemisphere, but sometimes because of the locality, one or two or of those strain in the vaccine vial are different. But so that at any given time, and there are two vaccines in the globe being administered in southern and northern hemisphere.
I never thought about that, and that makes so much sense. It really really does. As you know, the CDC has updated childhood vaccine recommendations. What are the most significant changes parents need to understand about those updated recommendations?
Well, to simply say, I mean, there are three major things. The one was the reduction in the in the vaccine under universal recommendation. We used to have 18, 17 to 18 vaccine, depending on counting dengue fever as well. Annually would be given, I mean, would be recommended for children's. Now CDC had reduced those number to 10 plus the varicella vaccine and had put the other seven into two other category. One category is identified as shared decision making uh, vaccine, and the other high risk groups. So not all the vaccines are that used to be in the previous year recommended list is universally recommended for 26 as of January 5th when the CDC announced the new recommendation. So they have removed, for example, hepatitis A, hepatitis B, meningococcal A, meningococcal B, and also rotavirus and RSV vaccine and flu vaccine out of the recommended list. One more changes in the recommended universally recommended vaccine is the reduction of the number of HPV vaccine that we used to give to the kids. We used to give at least between 2 to 3 doses, depending on the age of their recipients at the time of starting their immunization. Now CDC had reduced only one HPV vaccine for adolescents.
Mm. So you are, a father, even though you have adult children. Knowing what you know now, with scientific advances and a lot of information out there, would you change anything about uh, how your children were administered vaccines now compared to when they were children?
No, I'm not. Let me. One thing that has to be cleared. Remember, these guidelines are a recommendation only. There
Okay.
is no mandate, which doesn't mean that because CDC says so and so, you have to follow exactly what the CDC says. You can always use your judgment and ask You talk to your physician, talk to your provider, health provider, and come up with a decision to get the vaccine. That is why I'm encouraging everybody to do that, specifically for those vaccines that are currently are not in the recommended list. Families should talk to their family physician, to their pediatrician, to ask them about the benefits of getting the vaccine, and if they need more information, the healthcare provider would be the best person to guide them and to inform them about these vaccines.
And because I think it's one thing for people like yourself and like me who have adult children, but for very new parents, those who are either expecting or have had a child within the last 12 months, especially first time parents, this can be a very uneasy time for them because they don't know what to do. So what do you recommend? What are you telling your new pediatric patients' parents?
Parents have to be proactive. That means that you read, you get information. First of all, the information has to come from a reliable source. And these days, internet is not the most reliable source that you can have specifically for vaccination. But all of us have a trusted physician, a trusted doctor whom we trust. We can always go proactively. I'm planning to deliver in a couple of months for pregnant moms to their own obstetrician, who can refer them to have a prenatal visit with a pediatrician to talk about these things. Am I going to decide to give the vaccine or not to give the vaccine? These things has to happen early and timely. So some of those things, tragic reports that we are getting for young children succumbing to flu mortality could be prevented. This applies to other vaccines as well. Again, look for the knowledge, look for the information from the trusted sources, and take action on that one.
You mentioned earlier in this conversation about vaccination rates and how they have dropped significantly over the past year. When you see the numbers, see the percentages dropping, what concerns you, about that?
So those people who are not getting the vaccine, they're the double-edged sword. One, for themselves, they're not protected themselves. But as these rates comes down, the community becomes vulnerable. All these single individual here and there are going to be a reservoir for any invading virus or bacteria that comes in the community, because they are not protected. They get it and they pass it on to other people as well. So that is the same story as that in the current flu season, when we have almost 58% of population unprotected. It's very difficult for anything to work to reduce the severity and the mortality and the spread of the flu virus. So all I'm saying, that these people, we have to talk, we have to educate. Vaccination historically has shown that it's working. At one point in our time, this country alone had every year more than 880,000 measles per year. We reduced it to almost close to nothing. And over the past few years, with the declining rate of MMR vaccination, as of last December, there were 2,000 cases of measles in this country. Yeah. Unheard of.
Today, we are seeing unusually warm temperatures. A high today in the low 60s. This is January, okay? And so I'm sure that there are people who normally would be bundled up and staying at home who want to, go outside, and we could see a repeat of those temperatures tomorrow, what impact, if any, would today's warm temperatures, tomorrow's unseasonably warm temperatures have on the spread of the flu, if any at all?
So mainly outdoor activities that you put you in a sort of a increased contact with other individuals who may have carrying flu, or they have a flu, and and these viruses are susceptible to environmental temperature as well. So it will increase momentarily, this high temperature, increase their activity, increase their transmission, and then the next day, people who are unprotected and uninformed about the status of the outside, they could exposed as well. So yes, temperature has some effect on the virus activity, but really that is not the cause of infection. The cause of infection is the exposure to the virus. If you're unprotected, definitely you're going to get it.
The final question for you, Doctor. What do you believe are the three most important things families should do this week to protect themselves from the flu?
With all these rates that you mentioned, with all the report that you gave, number one message of this, we have to make it clear: go get your vaccine. Vaccinate yourself, and that is number one. Stay away from, if you're sick, stay home, do not come. Use preventive measure, which we mentioned, frequent hand washing, if in some cases regard nothing specifically for flu, but other things, wearing mask when you are in highly populated areas with other people's, sanitation, avoiding the, as I said, populated places. So mostly those two, plus the mask, in some cases, those are the really, and keeping yourself nourished, hydrated, always is a good thing. It will protect you. It will increase your defenses. But number one, vaccinate. Number two, protect yourself by hand washing, frequent hand washing, masking, and that is it. These are my messages for this flu season.
Dr. Habib Shariat, I want to thank you so much for your time and your information. It's so important. We don't want people to get sick, and just a reminder that the flu is not a cold, and in some cases it can be deadly. And so we want to make sure that people are protected as best they can and well informed. So again, thank you so much. I appreciate your time, sir.
You're welcome. Thank you very much. I'm glad to be here.
Sure thing. That is the Daily Drum for this Tuesday, January 7th. I'm Harold. No, what day is it? It's Wednesday.
It's Wednesday.
It's Wednesday. My goodness, I'm getting my days mixed up. Look, that's what happens when it's a new year. Everything gets crossed up. Here, let me try that again. That is the Daily Drum for this Wednesday, January 7th, 2026. I'm Harold Fisher. Good night.
Good night. Stay home, stay safe.
Thank you, sir.